We believe that a woman's body isn't broken, that her cycle is a superpower, that she is strong and she's created beautifully. We believe that a woman deserves the very best care and support. There's a new day dawning for women's healthcare. We invite you to be a part of the revolution. NFP, good for life.
And I really felt like to be good at fertility or surgery, I really had to focus on it. In a lot of places where there's not somebody who really specializes in endometriosis surgery, it's the cancer doctors who really are the ones who do the surgery, just to make the point that it can be that extent or level of surgery. The problem with cancer doctors doing endometriosis surgery is that they're not very good at preserving fertility. They just start taking out things, and they're not really into adhesion prevention. They just want to treat the cancer, which translates to treat the endo when they do that. So again, there are some real heroes out there who are doing it all, OB and surgery and everything. But for me, I decided if I was going to be good at endometriosis surgery and to do the research and publish on it, I really had to focus on the practical benefits. That's really what Humanae Vitae really called for, is not just a deeper understanding of why the church believes that for the good of marriages and families, and I think we're seeing that more and more, that you have to connect love and life. You cannot separate them. But then he called upon medical professionals to make it practical. And there are more and more really methods to avoid pregnancy. But in terms of achieving, that's the flip side. It's a true method of family planning, and you can use it as a very powerful tool to have a woman's health record and to achieve pregnancy. So just seeing all of that and how it can be so practical was eye-opening for me, and really got me excited about trying to provide this type of care for patients. I always say good ethics is good medicine. If what we believe about God's design for marriage and sexuality and family is true, then it should work and work well. It should be true, good, and beautiful. So I'm here to tell couples that, you're not passed over, that there is a plan, whatever that may be, for your family or for your marriage. And, she ended up having bad stage 4 endo. Again, after about a year of trying, she had painful periods her whole life. Said, maybe I have endometriosis. I said, no way. I didn't believe it at first. Turns out she had bad endo. And we were told we would never get pregnant but through IVF. And again, having lived through it, to have somebody do very minimal workup and then say, we don't really know why you're not getting pregnant. It used to be that everybody would get a diagnostic laparoscopy to look for and treat endo when they were infertile. Because up to 1 in 2, even without pain, can have endometriosis. Up to 80% of patients with pain and infertility will have endometriosis. So everybody, and surgery helps pain and fertility. So everybody used to get a diagnostic laparoscopy who were infertile, but now it's considered optional. And then you're put in this category of unexplained, which is like a third of infertility, they say these days. But if you look hard enough, you will find the problem. But to be told, we don't really know why you're not getting pregnant, but give us a bunch of money and we'll do IVF and bypass everything, make a baby in a test tube, put it back, that is not satisfactory to a lot of people. So just on the human level, there's so many reasons to really try to find the problem and fix it, which is the approach of the Restorative Fertility Clinic. Once I also saw an Instagram post. There was a baby laying there surrounded by a heart made of syringes.
I've seen that one too.
Which I think was a really powerful image of what IVF is like. And for a lot of women, they think IVF is the last stop, their last chance, their last hope. They don't get many good answers, though. It's not a fun process to go through. But if you can really dig deeper and have the patience or the perseverance to really look through or look under what the underlying factors in affecting fertility are, both surgical and non-surgical, and you correct those things, You get answers for the patient. And again,
Right.
for a patient dealing with infertility, not having the answer, my wife would say, that's half the problem.
Yeah.
And it's oftentimes more than one thing.
Mhm.
When you correct those things, you often feel better. When you treat endo, oftentimes the pain is less. When you correct the hormones, oftentimes they feel better with mood and things like that. It can lead to recurring fertility. It's billable. So we're always billing underlying diagnoses. We never bill infertility, which, if you think about it, is really a symptom
Right.
of something deeper.
Yeah.
And it can lead to recurring fertility. So for so many reasons, trying to stay focused on finding the underlying problem and fixing it, or problems, really makes sense to a lot of people.
Yeah. I mean, I love what you're saying too, because I know we've had some secondary infertility in our experience too. And I know that frustrating feeling of like, what am I doing wrong? But also as a woman, when you're going through infertility, you think, what's wrong with me? And when you look at like the IVF world, the whole focus is just on the end product. Like it doesn't really look at what's going on with the woman. It says you're only successful if you're able to get pregnant through IVF and you get this end product that we want. What you're describing is more this approach where like, hopefully we'll be able to heal your fertility, but first let's heal you and what's going on with you. What are your underlying issues as a woman? It's just, it speaks so powerfully to the dignity of women. And, you know, the gift of fertility is part of this, but what you're describing, you know, it's not just about the end goal of getting pregnant. It's about wanting to make sure that women themselves are healthy. And that's not the goal of IVF at all. So I just think it's a beautiful testimony. I love how you explained that, because it's just, it really is friendly to women. It's actual women's health.